Welcome and good morning. I am Lisa Perch. I'm your moderator this morning. I'm with Saidi Consulting, and it's my pleasure to welcome everyone to this session of the USAID Eastern and Caribbean Region Climate Summit. Our topic this morning is social health and economic impacts of climate change, and we're particularly honored to have a number of esteemed panelists and speakers with us this morning. As we enter into the discussions this morning, we bear in mind a number of important contexts for this symposium. We are lucky to have with us this morning the Deputy Chief of Mission of the U.S. Embassy for Barbados and the Eastern Caribbean, Joaquin Montserrat. We are also going to have opening remarks from panelists from a range of regional and international organizations, including the Caribbean Development Bank, the Pan American Health Organization, the Caribbean Public Health Agency, the UN Women Multi-Country Office for the Caribbean, as well as UNICEF Caribbean. We thank you all for taking the time to join us this morning and for sharing your insights and your remarks with us. As we set the stage for our esteemed speakers and honored panelists, we consider the fact that at this point in time, climate change is a necessary and urgent mission for all of us in the Caribbean and globally. The U.S. government in this context has demonstrated its renewed commitment to fighting climate change by rejoining the Paris Agreement in January of this year and engaging broadly and widely with many partners across the globe and in this region. We recognize the importance of strong partnerships in this context, and we've organized this symposium to look at ways in which we can work together, share information and best practices, and forge common and shared solutions to combat and also to increase resilience to climate change. This is the third of eight webinars that the USAID Eastern Caribbean and Southern Caribbean Mission is hosting throughout June 30th. And we are hoping that during the course of this symposium, you'll hear from a variety of experts, activists, and persons who are really just engaged broadly in climate change, including youth and policymakers, and hopefully we'll hear from you, the audience. I would like to take this opportunity at this point to invite the Deputy Chief of Mission at the U.S. Embassy for Barbados and the Eastern Caribbean, Mr. Joaquin Montserrat, who I hope I'm pronouncing your name correctly, who is with us today to provide some opening remarks. Deputy Chief, the floor is yours.
Thank you very much. The name was perfect. My mom wouldn't have said it better.
Thank you.
Good morning, all. It's a real privilege to be opening this third session. I'd like to acknowledge Mr. Dindial Ramratang from the Caribbean Development Bank, Dr. Laura Lee Boudram from the Caribbean Public Health Agency, Dr. Jonathan Drury from the Pan American Health Organization, Mr. David Knaut from the United Nations Children Emergency Fund, and Ms. Isuya Iyahen, representative from UN Women, as well as members of the press, my colleagues, my USAID colleagues around the table, and everyone who joins us today. Couldn't be more pleased to open the session 3 of the USAID's Climate Change Symposium. I am impressed with the lineup of panelists for this session, and I look forward to a spirited and informative dialogue. The United States is eager to find ways we can collaborate with our Eastern Caribbean neighbors to limit warming, create jobs, and protect our living environments. Climate change is our shared challenge. The record-breaking 2017 hurricane season stands as one of several recent examples that strongly underscore the economic, physical, and social vulnerability of Caribbean countries to climate phenomena. The same Hurricane Maria that devastated Barbuda and Dominica killed over 3,000 people in Puerto Rico and the U.S. Virgin Islands and cost over $90 billion in damage. In that same season, Hurricane Irma caused more than 70 deaths in Florida and cost $50 billion in damage. The Biden-Harris administration has made it clear that the United States will move quickly to build resilience both at home and abroad against the impacts of climate change. The United States is committed to reducing U.S. greenhouse gas emissions by 50 to 52% by 2030. In April, President Biden hosted the Leaders Summit on Climate to likewise encourage major emitters' mutual ambitions on climate goals. President Biden also announced the first ever U.S. International Climate Finance Plan, which doubles public international climate finance to $5.7 billion each year and triples annual funding for climate adaptation by 2024. As partners who face these calamities together, I want to be clear and leave no doubt that the United States is here and present. This is a team effort. As the Dalai Lama said, in today's interdependent world, individuals and nations can no longer resolve many of their problems by themselves. We need one another. It is our collective and individual responsibility to protect and nurture the global family, to support its weaker members, and to preserve and tend to the environment in which we all live. Thus, we will partner up with governments, the private sector, civil society, academia, and all willing to contribute to respond to the range of challenges experienced across the region. Last week at session 2 of the symposium, leading regional experts warned us about the current state of climate change in the region and shared sobering projections on what we can expect for the future. Today, our distinguished speakers will elaborate on the social science-related dimensions of climate change, including impacts on economies, health, and societies. We will also hear how climate change is creating real on-the-ground challenges for people and businesses across critical sectors like agriculture and aquatic ecosystems, and what we must do to safeguard livelihoods. To our virtual audience, we look forward to hearing from partners existing, future, and potential. We look forward to a true collaborative effort today on how to tackle this challenge we all face and are determined to address. Thank you for the opportunity to be here with you.
Thank you so much, Deputy Chief of Mission Montserrat, for those welcoming remarks, but also to really set the stage for our discussions this morning. We're really grateful to have had you here with us, and we will certainly bear that in mind as we move forward on our agenda. Good morning, participants, attendees, panelists, again, distinguished guests. It is really a pleasure to have you all here. I'll just do a quick run through of how our process will go this morning. After these remarks from the Deputy Chief of Mission, I will then invite our panelists to make some opening remarks, and I'll introduce them in a moment. I will then transition to asking them some questions, and then we will have an opportunity to also engage with you, the audience. We're really pleased to have with us this morning the following panelists who have already been presented by Deputy Chief of Mission Montserrat, but I will remind the audience again, particularly for those who've just joined us, of who we have with us this morning. We have Dindyal Ramratan, a statistician at the Caribbean Development Bank. We have with us Dr. Jonathan Drury, Climate Change and Health Advisor at the Pan American Health Organization. We have Dr. Laurelie Boudram, Head of Vector-Borne Diseases at the Caribbean Public Health Agency. We have Ms. Isua Yahin, Program Specialist for Economic Empowerment and Statistics at the UN Women Multicultural Office for the Caribbean. And last but not least, we have Mr. David Kanate, Climate Change and Environmental Specialist at UNICEF Caribbean. Welcome, one and all, to this session. I now take this opportunity to invite Dindyal Ramratan to make some opening remarks.
Hi, good morning all. Pleasure to be here and thanks for the opportunity. Before I kick off to the presentation, I'd like to thank my co-author, Jaron Boyce, a researcher here with the Economics Department. Everything good and pleasant looking in this presentation I owe to him, otherwise you'd have been seeing some numbers all over the place. So you all will be thankful for him as well. The presentation focuses on the reality post-COVID-19. What are the economic challenges facing the region? And to kick it off, what I would like to say is that COVID has presented numerous challenges that we have been addressing targeted and focused on throughout the last year and a half and possibly going into 2 years. This reality, though, does not change the constraints we were facing before 2019. And even as we get COVID under control and to some sense of normalcy, these challenges still exist. And I think it's important to build from this. It's almost like taking stock of where we're starting our rebuilding process from. When we look at the global impact of COVID, we are seeing the damage it did to growth in 2020, declines across both the advanced and emerging market economies. While we do see a return to growth or forecast a return to growth in 2021 and 2022, we did not really forecast for a full recovery. So we aren't going to be exactly where we were in 2018. Even with this recovery, we will be left somewhat short. What we are also seeing at the current time is already a pickup in commodity prices and trade. This has a dual impact for small island states such as the Caribbean. Our growth forecast and projected to increase as quickly as the rest of the world. So what will happen? The inflationary conditions we are seeing would lead to price impacts in the short run, but our wages won't be able to show a commensurate increase. And to highlight that, you could see that our regional growth forecast suggests a continued decline, the decline in 2020 and a slow pickup in 2021. With the inflationary conditions, we aren't expecting the ability to have a real impact on our economy just yet. And this creates a paradox now going forward for growth, where you may have situations of rising prices. We've heard reports of already in the shipping industries and the trade industries increased prices, but not an immediate return to growth in wages. Some of the main considerations we're going to look at today is the regional visitor industry. This is a key consideration for the Caribbean, and this is something that we have to look at going forward. We're going to look at our debt and primary balance reality. This is important for us to consider as it impacts our ability to invest in our economy and grow. And we're going to look at the unemployment effect. So just now having, right. When we look at regional growth and we look at the reality for the Caribbean, we are seeing a pattern that we hope does not continue. If you look at the graph on the right-hand side, what you are seeing is that the last recession we had, which was the global financial crisis, growth conditions in both the Caribbean and other small island developing states were greatly impacted. We saw declines in GDP and we saw contraction, if you to call it that, in the economies. What is very instructive in this chart is the fact that upon returning to growth, the gap between the blue line and the orange line, the blue being other small island developing states and the orange being the Caribbean, widened. This widening of the gap suggests that even when we return to growth, it wasn't equitable in line with other small island developing states. So it was almost as if we were left a little behind coming out of the recessionary impacts of the global financial crisis. Now, this is not something we want to see going forward. And important to consider here is what ties back to this conference, the relative exposure of the Caribbean countries to natural disasters. So we have the global financial crisis. We have the COVID impacts. But now we have to also consider the fact that we are very vulnerable to the effects of natural hazards. And this chart taken from an IMF report shows how much more vulnerable the Caribbean is compared to other small states. As a percent of GDP, damage from natural hazards is significantly higher. And also the frequency per 1,000 kilometers. We are small states and every year now, we keep hearing the term an above average season. So the more these events occur, the more damage that is potentially there for us to face. When we do look at the proportion of the population that is affected, we fare slightly better than the small states. But this, while mitigating, still doesn't take away the damage impact. And to put that damage impact into perspective, let's look at what has happened, over the last couple of years, 4 or 5 years from natural disasters. The Caribbean countries, the member countries of the Caribbean Development Bank, face cost of over US $27 billion due to loss and damages from natural events. Haiti faced 114% loss in GDP. Tropical Storm Erica constrained Dominica's GDP by 98%. Hurricane Maria came, probably a year or two after, if not the same year, 2 years after, and cost 200% of Dominica's GDP. Understand this in the context of a small country trying to rebuild and then facing another hazard which turns into a disaster. In 2019, more recently, we had 25% of Bahamas' GDP as damage and loss from Hurricane Dorian. So this puts into perspective the reality that the Caribbean faces, where as we rebuild, we still have to mitigate and face challenges posed by naturally occurring events. Now, bringing it back to something more present, let's look at the impact on tourism. This graph, to me, says it all coming out of COVID-19. That sharp drop in visitor arrivals is the mainstay for a lot of our Caribbean economies. And when you consider facing the threat of natural disasters, having a pandemic that has actually constrained your income to this level, it paints a picture that really needs innovative ideas to get us forward. Now, part of this trust has to be diversification. We need to, as Jaron says, we need to widen our portfolio to mitigate against some of these impacts that could really curtail you. The more monocultural economies are, what tends to happen is that you become almost at the whim of the global business cycle. And should anything exogenous or external affect the industry, it immediately passes on to you. And to show you how deep this passage is, let's look at the contribution to GDP, the share of employment, and the share of exports that tourism is for our economies. We are looking at, in terms of contribution to GDP, upwards of 50% in quite a few cases, and in the majority of cases, upwards of 40%. We have a couple commodity exporters, which keeps their tourism dependence low. But as you can see from this table, it's not in the majority. Share of employment, we're looking at yet again upwards of 40% being directly or indirectly employed in tourism, and in double digits for many of the country for immediate direct impacts. As exports, where we earn our foreign exchange and where we get the value of trade, we're looking at significantly high double-digit rates, in many cases, yet again, above 40%. So we are talking about almost 2/5 of the average Caribbean economy being dependent on the receipts from the tourism industry. So this is the need for diversification, to widen that portfolio so we are not as immediately impacted by singular industry shocks. But diversification is a more medium to long-term aim. So part of the rebuilding has to be, how do we make the most of what we have now while building for the future? And I mean, over the last 2 years, the word balance has been featuring heavily. Balance lives and livelihoods, balance the economy and society. We also have to think about how we balance today's economy with sustainability for tomorrow, for our future generation. To do this balancing act, we need to have the necessary levels of investment in our economies to build new industries and innovate existing ones. But our regions do face another important consideration. This is the fact that to do this balancing and to do this investment, we need to spend. And the primary balance, which looks at that expenditure over revenue consideration, has been revenue over expenditure has been largely negative due to the impacts of COVID, where revenues were curtailed and expenditures on health and social welfare has increased. when you have this imbalance, what it leads is to a buildup of debt. The traditional theory suggests 60% of debt to GDP is a sustainable amount for an economy to continue its growth path. But many of our countries are already above 60%, some actually crossing 100%. So this also is a constraint that we need to address, because while we need to invest and we need to protect, we also need to find ways to engender higher GDP growth so that we can build our economies and reduce this ratio. To put it into a perspective that makes it clear, when your debt as a percent of GDP is greater than 100%, what you are saying is you have more debts than is coming in. And that's almost like at the household level, the amount you owe is greater than your salary for the month. So if you think about it like that, we understand the importance of finding the balance between growth and spending so that we could actually restrain debt to some extent. And this brings me to what is if we want to take it down a level, where does it impact the population? Debt creates employment opportunities. Sorry, not debt. Growth creates employment opportunities. If our countries grow sustainably and they are able to spread these impacts throughout the economy, we can see declines in the unemployment rate. Currently, though, many of our countries are in double-digit rates. And some of the low ones have actually shown an uptick due to COVID. We could imagine with lockdowns, business closures, and for tourism-dependent countries, the border closures, the impact this would have had on the employment market. Now, this is how it impacts on the you and I. This is how it impacts on the persons. We need to engender growth sustainably and inclusively, that we reach a wide cross-section of the population. We have seen that the transition to technology in schools has in some cases increased inequalities because of the need to acquire infrastructure such as tablets and computers and even the broadband connectivity. The region faces an issue of high youth unemployment and adverse impacts on female labor force participation. For quite a few of our countries, even some of what we would call the higher income Caribbean countries, female labor force participation hovers around 50 to 60%. And if you think about it as potential capacity, if 40% of your population chooses or is discouraged from entering the labor force and adding to that buildup of national output, we are, in a sense, curtailing our own potential. Now, there is the consideration of unpaid care work, which to me is very much important. So we have to be able to filter out between discouraged and between persons choosing to take care of their families. But that's the kind of statistics we need to start getting at. How do we drill deeper to these numbers? And as you heard from my title, statistician, so obviously I shamelessly always put a plug, we need to improve on statistics so that we can get these sort of analytics coming out and be able to have evidence-based policy making. So it's critical at this juncture that we take stock of where we are and where we need to be. Some of our imperatives going forward is, of course, short-term and immediate advance in the vaccination program so we could get back to some sense of normalcy. But in the medium term, we already need to start thinking about reigniting an economy that was constrained for 2 years, managing fiscal and debt considerations, focusing specifically on getting benefits to reach the population through greater employment opportunities, through improving the working world where it could be more inclusive and attract a wider cross-section. And of course, as the theme of this seminar focuses on, building the necessary resilience to natural and health hazard events. Thank you.
Cindy, for that comprehensive overview and really setting how the COVID climate and natural hazards really present a challenge, but also an opportunity for our region. I will now invite Dr. Jonathan Drury from PAHO to make some remarks and to present to us some of his thoughts on health impacts and the links potentially between what we've learned from COVID and what we need to continue to do in our response to resilience for climate and other challenges. Dr. Jury, the floor is yours.
Thank you, Lisa. Thanks, everyone, for this opportunity to present. In the next few minutes, I'm just going to provide really an overview of some of the health impacts and what are the PAHO approaches to strengthening climate-resilient health systems in the Caribbean, and then share some points from WHO on a healthy recovery from COVID-19 and the linkages to climate change. So I think we've all seen slides like this where we know climate has an impact on health both directly and indirectly that is mediated through different systems. Here in the Caribbean, we've seen climatic impacts that have really begun to exceed what the health sector and others have experienced in the past. So it's hotter in some places. There are more extremes in terms of flooding and drought, more intense storms, indications of sea level rise. And the research in the Caribbean, while it's somewhat limited in climate and health, does indicate that vector-borne diseases are influenced by climate in some cases, in some countries. Disasters do have both the physical and the mental health implications. The issues with water quality and food security that have been documented, and of course the rising temperatures and the heat and how that affects some of the most vulnerable. And then air quality as it relates to emissions, other issues related to dust, and also the interplay with climate. Next slide, please. So this just lists some of the PAHO approaches to really strengthening climate resilient health systems here in the Caribbean. And all of our work has very much an equity lens, focusing on the most vulnerable. So very quickly, one element is really to work with the health sector to make sure that they're engaged in climate change discussions and committees, that health is at the table with the climate discussion. Also that they have a role in planning in terms of developing specific health adaptation plans, health vulnerability adaptation assessments, making sure health is included in the commitments by countries through the national designated contributions, infrastructure and services through programs like smart hospitals, but also working with the health sector to look at reduction in carbon emissions, sustainable procurement, working with partners like CARFA on health surveillance systems and how we make the linkages between health and climate data and integrate those systems. Health co-benefits, bringing forth the evidence on issues in countries and in the region that relate to health on emissions and that impact, as well as improving climate, also the impact on human health, the same with the built environment and how actions we take that will improve the environment will also have significant health benefits and economic implications there. Capacity building, making sure that the Caribbean does have a cadre of leaders, both from the health sector, environmental health sector, but also from other sectors, working together and prepared to develop some of these plans and programs. And then making sure there's a pipeline for financing for health and climate, which there has not been in the past. A lot of health and climate financing for the Caribbean. This is increasing, and PAHO is working with countries to prioritize some of the health issues and seek out funding. Next slide, please. So these are just some points from WHO about a healthy recovery for COVID-19 and those linkages with climate change. This next COP will be a significant one for health because of all the interest that exists there. WHO is working on a number of activities leading up to this and during the event, and some of the things that have been highlighted are the need for resilient health systems, having the health sector lead the way in emissions reductions, as I mentioned before, promoting health in the national designated contributions, and making sure those are inclusive and can be measured over time. And then also getting the health sector involved on advocacy for health. So some of this manifesto for healthy recovery from COVID-19, some of the areas that have been highlighted and prioritized are really protecting and preserving the source of human health being nature as the original source of clean air, water, and food, destruction of which we know increases risks of emerging infectious diseases. Invest in essential services from water, sanitation to clean energy, quick, healthy energy transitions. So we currently have over 7 million people a year that die from exposure to air pollution. So that's key. Healthy, sustainable food systems. Diseases caused by either lack of access to food or consumption of unhealthy, high-calorie diets are now one of the single largest causes of global ill health. And we know that those are also risk factors that are associated with illness and death from COVID-19. Healthy, livable cities. Over half of the world's population is in cities now and responsible for really over 60% of economic activity and greenhouse gas emissions. And subsidizing pollution globally over the past decade, about $400 billion of taxpayers' monies was spent every year directly subsidizing fossil fuels that are driving climate change and causing air pollution. So those are just a few introductory slides. I'll end here, and I'll provide a link in the chat to the WHO 2021 Global Conference on Health and Climate Change and some other resources. Thank you.
Thank you very much, Dr. Drury. That was fascinating in terms of looking at some of the issues that are on the table, and also, taking us back to some of the issues that were also raised by Dindial in his presentation. To continue on this stream of really important insights across sectors and within sectors, it's my pleasure to invite Dr. Laura Lee Boudram from CARFA to make her remarks. The floor is yours, Laura Lee.
Hey, thank you very much. Sorry, just confirming that you can see and hear me.
Yes, we can.
Okay, thank you. Right, so thank you again. It's lovely to be able to chat with the group this morning. I just wanted to bring some brief remarks on the Caribbean context and climate change, following very comprehensive intervention by Dr. Drury there. So very recently, in fact last week, CARFA was able to host our annual health research conference, and the theme for this year was pandemics, NCDs, and climate change. So I actually wanted to share some key points from the conference with you because I believe they're very relevant to today's discussion. So, as noted by some of the past speakers, there are major challenges facing Caribbean, small island developing states in relation to climate change. And there are some very important factors there that impact on social resilience in these countries. Now, at our recent conference, one of our featured speakers, Dr. Ditkus Jules, Director General for the OECS, brought some very comprehensive remarks, especially on what has been occurring and some of the strategies that the OECS has been recently taking, especially in relation to the COVID-19 pandemic. With respect to climate change, of course, we know that the region is very vulnerable. Over the years, we have seen an increase in the frequency and severity of storms, which have had heavy impacts in terms of loss of lives and, of course, economic duress. With respect to health, we've been recently, over the past year, involved in the global COVID-19 pandemic, and that has had many effects on different vulnerable groups, including those that suffer from chronic diseases. And we've been looking regionally on how we can best improve the services that we provide to this group and other vulnerable groups. In terms of the economy, we've been addressing issues such as food insecurity because we've been seeing reductions, of course, due to climate change in agricultural production. Additionally, other issues on the economy, as highlighted by some of our colleagues, are the issues of poverty and inequality among different groups. Then lastly, we have some geopolitical issues. The democracy process sometimes is under threat. There have been geopolitical realignments. Issues such as racism, sexism, intolerance, and violence have come to the fore, and multilateralism has been in retreat. Now, with respect to the COVID-19 pandemic and natural disasters, 2020 in particular was a very active year in terms of hurricane season. We had slightly over 13 named storms, and in terms of preparation and response, there was a strong need for the region to develop multi-hazard response plans and build a resilience in the health sector to mitigate potential impacts. So in terms of the COVID-19 pandemic and some of the specific challenge that the region faced in terms of preparation and early response from the health side, we needed to ensure at the very start that testing mechanisms were actually in place. It did take us about a month or two after first detection of the SARS-CoV-2 virus in other regions of the world before we were able to offer this service to the Caribbean. Other factors that are very important and applicable are social protection measures that would have been put in place in order to deal with the pandemic. For example, assistance that would have been provided to families and businesses during high-level lockdowns, as especially businesses were not able to operate. There was a convergence of the regional international agencies as well in support of that regional pandemic preparedness response. But there were some limitations that we faced, and one was the fact that we were a bit unprepared in terms of the health response, especially in the preliminary stages. We really had to marshal our forces, pool our resources, and increase our partnerships and collaborations in order to adequately start dealing with the pandemic. There were also some other issues, cultural challenges, how to effectively communicate with our communities and ensure that the relevant behavior change and appropriate measures were adopted by these communities in order to deal with the pandemic. We suffered, as seen in earlier introductions, from a lack of financial resources, and there's also the inability to engage all levels of society with respect to the response. Now, the OACS in particular came up with a multidimensional strategy for response to outbreak and disasters, and they referred to it as the HEST strategy, and it dealt with various factors such as health, economies, education, social issues, and security issues. So under health, strategies were developed with respect to intersecting issues of health lifestyles, food security, exercise. If you're under lockdown, of course, you can't get out there and exercise as you would normally do so. Economies, we have seen contraction in the tourism industry, increase in layoffs, and consequently unemployment. Under education, we've been able to see the shift to virtual learning environments and all the challenges and issues that our parents have to face in supervising their children during the school day. Social issues, social welfare has been a major factor. There's been an increase in poverty and hunger. And in order to deal with this, regional integration had to be addressed. There are also some security issues, especially relating to illegal immigration during the pandemic. What we needed to see, and largely, was that regional and international collaboration in order to mobilize resources to deal with the various issues that have been raised. One of the primary issues that we've been facing recently, of course, is procurement of the vaccine. This has to be leveraged from a regional perspective in order to ensure that it's equitable distribution across all our Caribbean countries. So just lastly, in closing, I just want to highlight some key partnerships and collaborations that have been taking place across the region in order to support the COVID-19 response. And many of our partners are listed here, including the European Union, the Agence Française de Développement, CDC, various U.S. global partnerships, Japanese government, PAHO, WHO, of course, CARPHA, and then also the tourism industry, the Caribbean Hotel and Tourism Association, and the Caribbean Tourism Organization. Yeah, so with that, I'd like to close. Thank you.
Thank you very much, Laura Lee, for your presentation and for bringing together both the dynamics of climate as well as COVID-19 and also issues of security, which sometimes we do not often keep on the agenda as well. It's my pleasure to now invite Ms. Isua Yahin from UN Women, the multi-country office in the Caribbean, to share some remarks with us. Thank you.
Thank you very much, Lisa. All protocols are observed. I have no PowerPoint presentation, but I think from the previous panelists would have really set the stage in terms of at the macro level what we are facing in this pandemic. So it comes as no surprise. Many of you will know that globally COVID-19 has impacted women and men differently. There has been no gender neutral impact, and this is due to pre-existing inequalities prior to the pandemic, which have now been magnified. So while more men than women have died from the pandemic, we know that in many countries, women have exited the labor force. And this is because they are more exposed. And in the Caribbean, as we would have seen from Mr. Ramjatan's presentation from CDB, more women work in tourism and accommodation and hotel sectors, restaurant sectors, more so than men. In many of our countries, well over 50%, in fact, fewer when compared to men, fewer men work in the sector than women. So it should come as no surprise that after the steep decline in tourist arrivals, that more women than men have experienced job losses since higher numbers of them work in these hard-hit sectors. And women are more likely to be exposed to as well because of the occupations in which they hold. More women tend to work in sectors where they interact with people in the health sectors, nurses, community health workers, grocery store workers, and so on. So there's been also a global increase as well in terms of domestic violence as women find themselves, unfortunately, during lockdowns, shut in their homes with abusers, and this represents increased opportunities for abuse, unfortunately. So our citizen security apparatus really needs to recognize and prioritize intimate partner violence and other forms of gender-based violence as well. And the pandemic showed that our security apparatus perhaps was not prepared to respond adequately. And we also see that women, due to the pandemic, have been disproportionately experiencing unpaid care and domestic work, which presents as a structural challenge to women's economic empowerment and women's economic security. And this clearly emerged as a key challenge that globally economies were unprepared for. Women do nearly 3 times as much unpaid care and domestic work as men globally. And I share the concern raised by my CDB colleague, Din Dial, that due to a lack of access to data, and this is one of the few regions in the world that doesn't have access to data on paid care and domestic work, but that is being rectified through work that UN Women and other agencies are doing currently to fill that data gap. But we see in the pandemic that the triple, quadruple burden, if you will, multiple burdens that women find themselves carrying within the home in terms of teaching their children from home, increasingly working from home, and all of that magnified has magnified and has resulted in this disproportionate increase in unpaid care and domestic work, which presents a structural challenge to their security. So I know that there are going to be questions coming for the moderators, from the moderators that I will respond to in terms of expounding on the gender differentials and the impact of the pandemic. But just to say that these issues are all interlinked and they are not mutually exclusive. Once we see that there is and understand from the pandemic that there is no sector, there is no area of the economy, if you will, that is that is not going to experience impacts. And once that experience impacts, that means that it impacts women and men, and therefore there will be gender differentials in impact. So I'll stop there and hand over back to the moderator. Thank you.
Thank you, Isua. Thank you also for, again, tying this more together very tightly and also just showing the ways in which there's always a human face to these dynamics. And sometimes, there are multiple faces even for the same individual. I would take this opportunity now to invite Mr. David Canote from UNICEF to also share some remarks with us from his perspective. Thank you, David.
Thank you very much, Lisa. Just checking if you see my video.
I can see and hear you.
That's great, yeah. So first of all, thank you to the organizers as well as to all the presenters for your rich introductory remarks. On behalf of UNICEF, I'm going to say a few words about the impact of the climate crisis on children. 30% of the region's population, with many linkages to some of the trends which have been already highlighted by the other presenters. So I will mostly focus on children living in poverty, as well as other often overlapping subgroups of vulnerable children, such as children living with disabilities, migrant children, as well as indigenous children, all of whom are represented among poor population out of proportion. 32% of children are living in poverty, against 20% of the average adult population. This is prior to the pandemic. As we all know, poor populations are bearing the brunt of the climate crisis. They do live in the most disaster-prone areas. They have less access to basic services and facilities, and they also have lower coping capacities. And in addition to deepening inequities, climate-related shocks are also increasing poverty levels in a way somehow which is quite similar to what we are seeing with the COVID-19 pandemic. In terms of health, the WHO estimates that more than 80% of illnesses, injuries, and death related to climate disasters are in children. The trend, of course, is the same in our region. And in the Caribbean, a growing trend as well in terms of health is more and more evidence on the mental health impact of the climate crisis on children and young people, which we can really look at from a very fresh perspective in the context of the COVID-19 pandemic, given that one of the main impacts of the pandemic on children is also on their mental health. So once again, we see a convergence of factors between the climate crisis and the pandemic. Another sector I would like to raise is the one of food security and nutrition. We all know that child obesity and overweight are major public health concerns in the Caribbean. And this cannot be delinked from declining agricultural capacity and unsustainable farming practices in the region. No reliance on imported foods, which correspond to more than 80% of the food consumed in the Caribbean, compared with 7% globally, is a major contributing factor to the adoption of unhealthy lifestyles and diets in the Caribbean, while at the same time contributing to climate change through emissions, carbon emissions. Yeah? And of course, to conclude, I would like to refer to a last sector, which is obviously the education sector, which has been dramatically hit by recent extreme weather events in the region. just to name the example of Irma and Maria, which has damaged or destroyed most schools in some of the islands, such as Dominica. And interestingly, once again, to make this comparison with the COVID-19 pandemic, as schools have closed over the past year or so as a result of the pandemic, we have seen that one priority for most countries in the Caribbean has been to ensure the continuity of the right to education for all and the recognition of teaching and learning processes as social and collective experiences critical for resilience and recovery, not only to the COVID-19 pandemic, but also to other shocks, such as the ones related to climate change. So this was just a few brief remarks, just to make these connections between climate crisis and the impacts of the COVID-19 pandemic on children. And I was really glad to hear from all the other presenters that the need to think in a way which is intersectoral and look at the bigger picture as well as the micro impact on specific groups. Yeah. Over to you.
Great.
Lisa.
Thank you. Thank you so much. Sorry. Thank you so much, David, for that. And yes, for tying those pieces again together very well, and ensuring indeed that we look at the macro, the meso, and the micro. These are all very relevant in the Caribbean region, often are intersecting and overlapping. I take this opportunity now to turn to some really interesting and pertinent questions coming from our audience. The first question is for Dindial at CDB. It is from your research and that of your team, can we, that is us Caribbean countries, expect a positive increase in revenues in the next 2 to 5 years from tourism?
Yeah, I won't pretend like I have a magic ball, but given that we did see some dramatic and steep declines in visitor arrivals over the last 2 years, should the global travel industry recover, we could expect to see some amount of visitors returning. To me, the bigger question is actually, what type of recovery do we expect to see in tourism? Where the numbers will go? Will they return to pre-pandemic levels? Do we have to expect a different type of tourists for a different type of stay? And these are the questions we need to answer in terms of the forecasting for the potential return to activity in the industry.
Thank you for that, Dindia. I think that that certainly tells us that while there's potential, there's still some work we need to do to be able to ensure that there will be positive growth. And certainly looking at as we in the next 2 to 5 years, we also consider that we may be facing at least another 2 or 3 hurricane seasons. The next question is on health, and there are actually 2 questions on health. So I'll do the third one first and ask you to bear in mind this second part of it. The question is, given the evidence that vulnerable populations, that is women, children, and the differently abled, are the most significantly impacted by climate change, pandemics, and other issues, what are PAHO and CARFA's concrete plans for addressing these inequalities that have been evidenced for multiple decades? The other question asks about whether we need a massive increase in the number of healthcare professionals, and I think that perhaps can be weaved in to your response to the first. Do you need me to repeat, Jonathan and Laura Lee?
No, thank you. Those are clear.
Okay, great. Over to you.
Yeah. Laura Lee, I'll go ahead first then. I think the vulnerable populations are very, very important. I think the work that we're doing that I highlighted earlier really does get at these populations in terms of having countries work on plans that allow them to determine who are the most vulnerable and what are the geographic areas that are most likely to be affected or are being affected, and how then we can develop plans to reach them through both internal and external funding. So I think that's part of the planning process that PAHO is working on with countries and partners, is to try to link climate and health and use specific tools to target populations that are going to be most affected, and then work with others to identify solutions through adaptation and mitigation. And I think our communications plan, too, is really trying to reach those populations as much as we can with recently doing public climate and health public perception surveys to see what the general public and some of the vulnerable really feel about climate and health, and how health is being influenced, and what they can do about it, what they know that their governments are doing about it. And so having that data is important. As far as the healthcare providers, I can say that in terms of a lot of the work that needs to be done in climate and health, there is a shortage of consultants and healthcare providers. So I think Paho, Karfa, and others will continue to work on building the capacity, not just through trainings, but trying to work on both the workforce at the undergraduate and graduate level to promote some of these career paths. Thanks.
Hey, Jonathan. Laura Lee, the floor is yours.
Well, I think Jonathan well described some of the various interventions with respect to climate and change and vulnerable population, and we are actually collaborating with PAHO right now on the EU-funded climate project, strengthening climate resilience health systems within the region. Just to add a bit to what Jonathan has indicated, PAHO's work with vulnerable populations is a bit varied, but a good recent example of some that we've been able to do are actually on the lines of health communications and health promotion. So very recently, we have been working with the deaf community within Trinidad and Tobago, specifically the Deaf Pioneers group. And we've been working with them to generate health promotion messaging videos specifically for the deaf population. So that was very recently launched, and it was very well received. And one interesting thing is that the Deaf Pioneers Life Center, it's a husband and wife team, but the wife is very much in the lead there. Just to get back a little bit in terms of health professionals, and do we need a lot more in the region? Most definitely. This is part of the various capacity building assessments we've been conducting across the region in terms of general workforce development and our public health professionals. And there are a couple of major interventions that are currently taking place. One has been in place for about 5-6 years, and that's the Caribbean Regional Field Epidemiology and Laboratory Training Program, and that works with our ministries of health in training different health professionals from different areas in terms of disease surveillance, outbreak response, and management. So that is, it's a new program, new-ish, but it has produced many health professionals who are really targeted in this particular area of emergency response. Under that EU Climate Health project that I recently mentioned, there's also a fellowship program in terms of climate and health that has been launched, and that's being led by the UWI. So we're really hoping within the next few years to put forward some health professionals that are able to adequately address and provide leadership in this area. Okay, thank you. Over.
Great. Thank you very much, Laura Lee. You've also, both you and Jonathan have also addressed another question we had about a nursing, I think it's BSc by UE, in terms of the near future. And even if that doesn't happen, some of the ways in which you are engaging with the regional educational institutions to boost capacity, but also, technical know-how to bring in some of these areas that perhaps were not part of nursing and doctoral degrees in the past, in terms of addressing issues like climate change. So thank you for anticipating those questions as well and covering that. I'm going to turn the next question then to Isua and David, and that question is as follows. It is, can you tell us from the perspective of your organizations in particular, the ways in which you're planning to positively impact the various social resilience frameworks in the countries in the region and at the regional level? So to tie some of your work in terms of the very specific question about social resilience frameworks that I think has permeated across all of your presentations and which you've highlighted. So,
Okay, shall I
Isua,
go
would you like to
first?
go first? Sure.
Yes, thanks. So we address these as UN Women in different ways. As I said earlier, there are structural barriers to women's economic security, and our work addresses what we consider to be and what is globally understood to be the structural barriers, right? So I mentioned one earlier on the recognition of unpaid care work. When women are not able to, and this is not only a woman's issue, this is, a household issue. This was magnified during the pandemic. If we are not able to reduce the prevalence, if you will, of unpaid care and domestic work, we see a structural barrier to entering into the economy and staying in the economy. But as I said, we are experiencing challenges not only in data in relation to social protection, but other areas as well as social statistics, as Dindia well knows. We participate in many meetings together on these data gaps. So we are, with support of the SDG fund, piloting a measurement approach of unpaid care work that CARICOM member states can all adopt and use as a to produce and comparatively assess unpaid care and domestic work. In terms of the policy interventions, also we have been working again with support from the UN Joint Program and prior joint programs on social protection policies to introduce in social protection policies, specific recognition of addressing this burden of unpaid care work, which means access to care services needs to become a recognized part of a social protection framework. Access to elder care services, access to, and I'm going to address another structural barrier here, which is skills and knowledge, right? So we want all of this to be part of what is considered social protection at a policy level. At an operational level, we've also been piloting service delivery as well to address this care burden. So in St. Lucia, we are currently involved in a pilot project where we are supporting women beneficiaries of a cash transfer program to not only access these cash transfers, but at the same time, over a 2-year period, we are monitoring to see what happens to their ability to enter into the paid labor market when they have access to daycare, when they are fast-tracked for access to skills training, when they are fast-tracked, and you'll be surprised to see that even things like remedial learning at those levels or household levels are still present with us, where many women on public assistance have problems with reading and writing. We have also entered into a partnership with another joint program, the Win-Win Joint Program, on engagement with the private sector to create an enabling environment for women to participate in the private sector, either as owners and operators of businesses, but also to make the environment of the private sector more amenable so that women will stay, employed in private corporations. And so this means adopting within private corporations policies on sexual harassment, equal pay for equal work, and so on. And then as SME owners and operators, what kind of supports can they access to be able to make them functional in the and competitive, in the economy. So there are other interventions I can mention, but I don't want to take up all of the time, and I'm sure we'll have opportunities during our discussion to expound further on this. But just to end by saying that our work increasingly as an agency in the Caribbean has shifted towards addressing the root causes, the structural barriers to women's economic insecurity. Thank you.
Thank you very much, Isua. I think that's a very important element to support. David, over to you.
Yes, I will say a few words maybe by highlighting 3 different approaches. But firstly, to highlight that as the UN is preparing its new pluriannual plan now for the Caribbean in the coming 5 years, one of the major trends is that we really try to work as one UN, and there is already a sense of collaboration between UN agencies. Make sure that we work with different ministries and sectors in a way which is cohesive and complementary, And so many of the programs mentioned by Isua somehow involve several UN agencies. And as well as another priority is not only support frameworks at the regional level, but also to have country plans of collaboration on the resilience agenda cognizant of the fact that we need to be able to work directly with specific governments and not only at a regional level. So, yeah, so the first approach I wanted to highlight is, of course, in terms of supporting of a number of policy frameworks. There will be many examples because climate crisis is impacting all sectors. So, of course, a priority for UNICEF is to promote top responsive social protection systems across the region and making sure that the most vulnerable households are more resilient and are safe in times of disaster and can recover faster than during previous disasters. That's one example. Of course, a priority for many UN agencies, including UNICEF, is to support the preparation of revised nationally determined contributions, NDCs, the new climate change targets adopted by all countries, including the Caribbean, since last year, which have to be submitted before COP26 in November. For UNICEF, what we want is to make sure that these NDCs have clear linkages to the SDGs, as well as cover the needs and the agency of children and young people, which was not the case of the previous generation of NDCs. So we want child-sensitive and youth-sensitive NDCs, as well as national adaptation plans. No? The second approach is, of course, to work with countries in the region and facilitate access to climate finance. We try to work with countries to get some projects funded by the Green Climate Fund, the Adaptation Fund. Some of the UN agencies are accredited to these entities. Some of us, like UNICEF, provide technical support for sectors such as health, such as education, to be covered by climate finance, which is not the case until now. So we need to make sure that social sectors and social resilient sectors benefit from this new source of financing. Mm-hmm. And the third and last approach from the perspective of UNICEF is, of course, to promote right-based approaches. We need to make sure that we give the floor to the people. We need participatory approaches and promote the right to be heard, especially of young people and children. No, so we want to make sure that all these policy frameworks and these are designed in a way which takes into account the perspective and the voice of young people and other vulnerable groups. So this is really a requirement. No, so that's the number of approaches which we are trying to pursue to support social resilience frameworks in the region.
Thank you, David. We've got two more questions, but before I go to those, I wanted to ask if any of our other panelists wanted to jump in and make any brief remarks on this point. I have a question that follows on from it, so do let me know if you want to answer or you just want me to go into the next question. Anyone? Okay, so let me read the question. I think is a nice follow-on. This is a question for anyone. It is, what are the fundamental policy changes required to build a recovery that is climate and inclusive resilient? So both climate and inclusive in terms of resilience. Any thoughts from our panelists? And so I think this might be a way of just thinking about, if you had to give 1 to 2 or 3 policy changes that you would highlight that you think absolutely need to be there, what might those be?
I won't jump in.
Go ahead, Dindial. Go ahead.
Oh, I should have waited till the end then.
No, it's okay. Go ahead.
Yeah, I think it's about engaging with the community groups and engaging across all levels of interaction. If we want it to be inclusive, it has to be almost a bottom-up approach where we get a lot of voices in and build according to need. And also, you mentioned the word resilience, so it also has to take into account potential threats and what we do expect to be facing, and we build in line with that. So it's actually building today for tomorrow as well.
Okay, great. Thanks, Dindial. Anyone else wants to respond to that last question?
I could make a contribution. I think the COVID-19 pandemic has forced us to really recognize that our own definition and understanding of resilience needs to change. and that whatever policy, whatever policy, sorry, my earphone has dropped out. Whatever policies, priorities we think are priorities in the climate sector need to have embedded in them some kind of recognition that the impact is not neutral. The impact on women and men are not neutral. The impact on children is not neutral. The impact on migrants are not neutral. And all of these intersecting vulnerabilities need to be clearly present in our resilience frameworks, whether we are speaking about resilience in terms of economic resilience, our poverty reduction policies, our climate change policies, people, planet, prosperity, right? Our engagement in all sectors, I think, needs to recognize that we're facing grand and multidimensional challenges, and so therefore the response has to be integrated. And so I think that if there's a takeaway from the COVID-19 pandemic is that one vulnerability is not mutually exclusive from the other, and therefore our response cannot be siloed. So that's my food for thought, and something that those of us working in gender equality have recognized for a very long time. And I think if there's any silver lining in this pandemic is that it's quite clear that we need to have integrated and gender responsive policy responses.
Thank you, Isua. Did anybody else want to join or make a comment here? Laura Lee, David, or Jonathan, to amplify any of the points made or to add to the points on the table?
Thanks. Nothing further for me. I think the whole of society approach and the multi-sectoral approach, cross-cutting issues were very well addressed.
Okay, great. Thank you very much, Laura Lee. Yes, I don't think we can emphasize that too much, and certainly there are a number of interventions ongoing that are trying to promote and to, I guess you would say, embed those in the way that we do this work going forward. So Dindyal, the question for you builds on this, in fact, but takes our attention, I guess, to the issue of economic resilience and economic planning. And the audience member, acknowledges the fact that CDB itself seems to be focused on the severity of current and future climate threats, and congratulates you on your presentation, but wants to know what concrete strategies are being or have been adopted by the Caribbean Development Bank to ensure that economic planning is climate responsive.
Right. Thanks for the question. I think firstly it's important to know that in all our areas of operations, we do have a climate dimension, whether it's country programming, project design, or policy dialogue. We focus on the climate aspects of it throughout. And in fact, when designing our strategies, we place particular emphasis on the impact on climate and the ability to mitigate. Also, the NDCs are spoken about by my colleague earlier. The nationally determined contributions also feeds into how we design our strategies, and we make sure to take consideration of this. And it's interesting that this question would come because in 2018, CDB actually updated its climate resilience strategy, so this runs 2019 to 2024. And it place focus on enhanced and sustained adaptation actions to promote disaster risk reduction and poverty. So at the high level, look, our projects need to get this message across. It needs to be part of our interventions. And furthermore, the strategy speaks to sectoral assessments to support the design of climate resilient policies, plans, and governance frameworks. So we don't only look at it from the physical infrastructure aspect, but also from governance and how we design our oversight of these projects. All this is, of course, done in keeping with the country's nationally determined contribution priorities. Thanks.
Great. Thank you very much, Dindyal, and thank you so much for bringing up the issue of governance. Again, an issue that perhaps sometimes we forget is critical to actually guiding, overseeing, and making sure that our commitments and our plans actually take place and actually have the impacts that are desired. There is a follow-up question in terms of whether any of the panelists can provide examples of climate financing that supports both climate and health activities. for the CDB. You're quite popular, Dindale. What concrete strategies, are taking place in that context, that may be enabling of the work that both Jonathan and also Laura Lee have raised specifically for the health sector, and some of the points that Isua and David have raised from the social health dynamic perspective.
Yeah, I mean, after taking up so much time with the presentation, I'm surprised to still be allowed to talk, but thanks. I think all the panelists addressed it, and it's critical that the intersectoral nature of responding to crises is so important that even when we do economic or social interventions, it's cross-cutting. And across the board, we also have had partnerships, I believe, with everyone at the table, and we are open to partnerships. So sometimes it might not be that we launch a project titled health, but in our intervention, it does reach, and that's the important aspect. And also it's about finding the key word for me is balance between when we even manage the economic and social, how it reaches the different aspects of society.
Thank you, Dindale. Does anyone else on the panel want to also respond to this issue of climate financing, specific for climate and health, and where you think some of the leveraging points might need to be?
Sorry.
Go ahead. Okay. Yeah, no, I was just going to say, as Laura Lee mentioned before, this EU CARICOM Strengthening Climate Resilient Health Systems project is one that really gets at that, in the sense that we're trying to build up evidence at the country level in terms of what are their health and climate needs, and based upon that, we're working with the 5 Cs out of Belize to support the development of really innovative concept notes for health and climate. And so I think this issue has moved along in the Caribbean. I think there still is a long way to go. A lot of the funds now are readiness funds, which will help countries to prepare their climate strategies and workforce for larger projects. And some of those that have been identified are related to making sure that healthcare system, actual infrastructure is more resilient, and that it's not only resilient structurally, but also that the water and the energy are resilient. And in addition to that, something that CARFA works a lot on, early warning systems is another area that's come up with a lot of interest in how you develop those systems for health and climate that go beyond early warning for disasters, but really help target those vulnerable communities also in terms of what other infectious diseases or related to dust or other respiratory diseases may have an impact on human health, and how we do a better job of tracking that. Thanks.
And obviously there's again the need for integrated approaches. Now there is this project we are currently preparing with PAHO as well as FAO for the agricultural sector, an integrated approach to resilience building in one of the countries in the region now. And in terms of climate and health activities, one of them is to promote and support education to climate and health in schools now. So Jonathan was highlighting some of these hard components related to infrastructure and early warning systems. And there is also this more soft component and raising awareness and knowledge, spread knowledge among key stakeholders. So we need really this comprehensive approach, yeah?
Thank you so much, David. I was thinking myself that yes, we needed to highlight both the elements that were raised by all of you in terms of this, not just the roads and the bridges and the buildings, but there are these soft infrastructure elements that are really key, including early warning, but things like knowledge, which is, I think all of you have mentioned in various forms. If people don't know and they don't feel capable of acting on information, they're still going to continue to be vulnerable. So thank you for making that point. Isua, we have a question that's very specific for you. It says, you mentioned the UN pilot cash transfer project in St. Lucia. Does your assistance also extend to the private sector or private sector initiatives?
No, unfortunately, it doesn't. But what we advocate for through the other joint program I mentioned, the Win-Win Project, which is funded by the EU, is to ensure that there is recognition for the support supports being provided to medium and small enterprises to have a gender lens. And this is very important. We are still undertaking an analysis of stimulus packages in the region and globally to assess what support has really been provided post-crisis to women-led MSMEs. And we hope to, at some point, share that. But just to say that, no, unfortunately, our support, the cash transfer program I mentioned is really targeted at women living below the poverty line, and particularly women with care burdens, child care burdens, specifically, that may prevent them from equitably participating in the labor market.
Isua, for speaking a little bit more on that point, addressing the question about the role of the private sector engagement and other ways in which you're doing so. I want to thank our audience for, a set and a round of very, piercing and incisive questions that help to pull out a little bit more some of the key issues and some of the issues and concerns that are common across our panelists. As I take a look at the time, I wanted to invite our panelists now to make some final remarks in terms of, their final thoughts. And in doing so, I'd like them to really think about 1 to 2 key things that they would want or be willing to do differently tomorrow, that they think would help to move us towards this path that they've started to design and put and shape for all of us in terms of thinking about climate resilience, but also just broader resilience in a region that is faced by a number of challenges, but as well as opportunities. So 1 to 2 key things you think will be critical going forward in addressing social, health, and economic resilience issues and opportunities. And I will give the floor to, maybe I'll start with David this time.
That's great. So just trying to think of some points I could raise. Just didn't want to repeat what we have already highlighted in the session. So what I would like to share to conclude is 2 bad news as a call for action. No, the first one is last week an informal negotiation process prior to COP26 was concluded on the 17th of June, and the main conclusion is that there has been little progress in these negotiations on the most sticking point of most relevance for the Caribbean countries, such as negotiations around Article number 6 on contributions of the international community to the transition and to climate finance. No, so it's so important to be aware of that and advocate together as one Caribbean for increased ambitions on the road to COP26 and international solidarity. And the second bad news is just yesterday, I read in the press that the upcoming report of the IPCC, which is going to be released in February 2022, so quite in some time, has somehow leaked in the press. So it has not yet been released publicly, but some of the key conclusions have been circulated. And they bring quite a lot of worrisome news, such as, for instance, that from 2026, we will have full year above 1.5 degrees already. So not in 2050 or in a distant future, in 2026, in 5 years' time, no? So really, it's so important to build the resilience of our nations today, because the impacts are not going to wait for decades to affect us, our economies, our societies. We need strong action now within the Caribbean, as well as one voice to call for more action at the global level, as we are approaching a crucial event with the COP26 in just 5 months. Yeah.
Great. Thank you very much, David. Continuing my reverse order, I'll ask Isua to give her final thought in 1 to 2 minutes.
Thank you very much, Lisa. I think we need a cultural support shift in terms of our support for gender equality, and that we need to understand that women's and men's progress is not mutually exclusive. What is good for women is good for men, and vice versa. And I mention this because when we analyze the response to the COVID-19 pandemic, it really was a shock in terms of the response and how equitable or lack thereof this response was. So, for example, our social protection systems need to become more gender responsive. We need to address the root causes of the challenges that we face and don't postpone addressing these challenges until a crisis hits. So I had mentioned one, which was, barriers to economic, barriers to labor force participation and employment. The issue of childcare and other care services only came to the fore in a major way when we had a crisis. And this is at a global and regional and national level. Things like introducing equitable and flexible work arrangements. COVID-19 has proven that this is possible, and this will address some of those barriers to participating equitably in the economy. And infrastructure. I think one of the speakers mentioned earlier challenges with even accessing infrastructure and what that means as our economies shift towards being more digital in focus. That means that support to MSMEs, supports to our poverty reduction strategies, our climate strategies need to also understand and entertain kind of a broader perspective in terms of what infrastructure means. And infrastructure means not only physical, but also access to internet and ICT and care services. So I think what is needed is this mind shift to what resilience means, towards a greater acceptance of gender equality and prioritizing these as priorities in our policy frameworks. And lastly, this is all theoretical if there is no financing to back it up. And I know India will love to hear me say this. He presented a ratio in terms of investment in healthcare services and social protection and comparing that as a ratio to revenue generation. And I want to say that those two don't necessarily have to be mutually exclusive, and to balance come to a balance between the two. Actually, you can argue that our investment in social services is what led to greater protections of our populations from the impact of this crisis. The question is, what kind of economy do we want to see that would generate revenue in a way that is equitable so that we can maintain and even increase our current investment in social protection, including our health system? Thank you.
Thank you, Ensur. Indeed, I think one of the things that we often have to think about for our region, particularly the way we're structured and the needs that we have, that not all debt is bad debt, and some of our debt is necessary and integral to really addressing some of the economic and environmental issues that we have. So thanks for raising that point. I will then now ask Laura Lee to make her final 1 minute or so of thoughts to share with us.
Sure. Just a quick look at maybe one or two key actions in support of gender equality and social inclusion, especially within the resilience framework. So from the health perspective, I would probably look at ensuring that any key guidelines, strategic documents, or IEC materials are developed in a manner that actually influence or encourage healthcare workers, ministries of health and disaster management organizations to actually include the involvement of various vulnerable populations. For example, in the identification, development, implementation and monitoring of interventions and initiatives that are geared towards addressing the impact of outbreaks and climate-related disasters. Additionally, I'd like to see our countries, specifically looking at the ministries of health, civil society organizations, and even faith-based organizations, build capacity in social inclusion and gender, both within their individual organizations as well as at the community level. And lastly, focusing on empowering people with disabilities, women, and non-binary persons to take active roles in decision-making with respect to outbreaks and disasters within the community environment. Okay, so thank you, over.
Thank you very much, Laura Lee. Excellent ways of pulling out some of the key elements and some of the groups, including non-binary persons. That I think those are going to be really important as we go forward. Jonathan, if you will, the floor is yours to make your final remarks.
Yeah, thank you. I think the emergence of the pandemic and then the climate crisis, they obviously both disproportionately affect the most vulnerable and the economically disadvantaged. So I think understanding those challenges are essential for us to develop strategies in the future. So I think investment in health systems, and as Laura Lee mentioned, health disparities is important. And then the pandemic really highlights the need for an integrated approach to human health, and learning, what we already know from strengthening sensible public health programs. So I think environmental health, in terms of air quality, water sanitation, ventilation, waste management now, with COVID-19, that's changed as it does with disasters, and also just safeguarding biodiversity. That will reduce the vulnerability of communities to pandemics and improve well-being and resilience. And on that same line, I think the increasing floods, heat waves, droughts, these events a lot of times overlap both in time and in place. And so infection control is being jeopardized. So I think we have to look at that interplay too between COVID-19. And finally, just to mention the EU Care Forum project that I put in the chat and that several people have mentioned, we really appreciate UNICEF and CARFA's partnership on that. The project aims to really get at some of the things that have been mentioned today. So I encourage people to take a look at that. Thank you.
So much, Jonathan. I think that's really key, and I really appreciate it from the perspective that you raised on environmental health and environmental issues, as well as David, as well as others, because I think often sometimes we are siloing out some of the environmental aspects of this, even as we focus on social and economic systems and resilience. So I think those points were really well taken. Last but not least is Dindial from the Caribbean Development Bank.
Yeah, thanks. I guess the one point I had that will be building on what everyone said is inclusive and sustainable growth. I think that's key. And I mean, Isira always calls me out, so I always have to be prepared. But yes, part of that is in finding growth, finding ways to make sure we reach everyone. And this, through even welfare, through education, through health, if we provide a means for everyone to increase their capabilities, it adds to the long-term development. So it isn't just about a growth number, it's about making sure it's inclusive and it's sustainable. And to me, the second major thing I think that could really take us forward is making use of our human capital, research, innovation, statistics, building on this, and finding the right mix whereby we could, for ourselves, have the necessary evidence to inform the decisions we make. And yeah, shamelessly, statistics. Yeah, thanks.
Thank you, Dindial. And Isua approves. I saw a thumbs up, or two, actually. So thank you very much for that to all our esteemed panelists. Sincerely for a really rich panorama of information, perspectives, lessons learned, and also programming and initiatives that you're already putting in place. I'd like to also thank our audience, our excellent audience, for these incredible questions that you put on the table in terms of pushing us to think deeper and broader, and also think in a more interconnected way. It's been a pleasure to facilitate or moderate and support this process this morning, and really to be able to bring these perspectives to the fore. And I'm hoping that those who are not able to attend will be able to listen in and hear from you, and also learn from the process and the discussion we had this morning. I would like to also remind that this is one of a series of webinars. We have another one in just over an hour and a half this afternoon, where we'll be looking at some of the sectoral realities, and you would have heard from our panelists the importance of water and sanitation, for example, the importance of agriculture and food security, the importance of energy, and the importance of the fishery sector. Well, that panel that comes this afternoon will be looking at exactly those issues, and they'll be building nicely on some of the issues that were raised this morning, including the importance of environmental health and environmental resilience if we are going to be economically and socially resilient. The next session is coming up. We really hope that you'll join us there. If you can't, we will continue to engage and make sure that some key questions are presented, and certainly you'll have access to the recordings. I want to thank everyone again, including the USAID Office for the Eastern and Southern Caribbean, the U.S. missions in various countries across the Eastern and Southern Caribbean, as well as environmental incentives, who have been coordinating and supporting this symposium, and all of you, our panelists and our audience, for a great session, and looking forward to working and partnering with you as we go forward to actually walk the talk that we've had this morning, and also invest not only from outside, but by ourselves in terms of our climate and sustainable development futures. Thank you, and looking forward to further discussions as we go forward.